Depression. It's a word whispered in hushed tones, often misunderstood and shrouded in stigma. But behind this label lies a genuine and debilitating condition that affects millions worldwide. It's not simply a case of feeling down or having a bad day. Depression casts a long shadow impacting every aspect of a person's life. Imagine a weight pressing down on you, making it difficult to breathe, to think, to find joy in anything. That's the reality of depression for countless individuals. It's a thief that steals away motivation, energy, and even the ability to experience pleasure. This essay aims to shed light on this often misunderstood condition. We'll explore the causes of depression, delve into its symptoms, and discuss various treatment options. More importantly, we'll emphasize the crucial need for understanding, support, and hope in the face of this challenging condition. The journey through depression can be long and arduous, but it is not a journey anyone needs to take alone. By understanding the nature of depression and the many pathways to healing, we can extend a hand to those who suffer and guide them toward a brighter tomorrow. Depression's grip extends far beyond just our emotions. It casts a wide net, impacting both our mental and physical well-being. It's a complex condition that can affect every aspect of our lives, from our thoughts and feelings to our behaviors and physical health. Understanding the multifaceted nature of depression is crucial in recognizing its profound impact. Mentally, depression can manifest as persistent sadness, feelings of hopelessness, and a loss of interest in activities once enjoyed. These emotional symptoms can be overwhelming, making it difficult to find joy or motivation in daily life. The mind becomes a battleground where negative thoughts and feelings of worthlessness dominate. The world can seem bleak and colorless, devoid of the vibrancy and joy that once filled it. This altered perception can make even the simplest tasks feel insurmountable. The beauty of life fades into the background, replaced by a pervasive sense of emptiness and despair. Concentration becomes a struggle, making it difficult to focus on work, studies, or even simple conversations. The mind feels foggy, and tasks that once seemed straightforward now require immense effort. This cognitive impairment can lead to frustration and a sense of inadequacy. Decision-making, even for minor things, can feel overwhelming. The ability to make choices is hindered by constant self-doubt and anxiety. This indecisiveness can further exacerbate feelings of helplessness and loss of control. Sleep patterns are often disrupted, with some experiencing insomnia while others struggle to get out of bed, weighed down by fatigue and a lack of motivation. This disruption in sleep can create a vicious cycle, where lack of rest exacerbates depressive symptoms, making it even harder to cope. Physically, depression can lead to changes in appetite and weight, either a loss of interest in food or an increased craving for comfort foods. These changes can result in significant weight loss or gain, further impacting one's physical health and self-esteem. Headaches, muscle aches, and digestive issues are also common complaints. These physical symptoms can be debilitating, adding another layer of suffering to the emotional and cognitive challenges of depression. In severe cases, individuals might even experience thoughts of self-harm or suicide. These thoughts are a cry for help, a sign that the pain has become unbearable. It's crucial to take these feelings seriously and seek immediate support. The impact of depression is profound and far-reaching, affecting not only the individual but also their relationships with family, friends, and colleagues. Social interactions can become strained, leading to isolation and loneliness, which can further deepen the depressive state. It's crucial to remember that depression is not a sign of weakness. It's a real illness that requires understanding, compassion, and appropriate treatment. Seeking help from mental health professionals, talking to supportive friends and family, and exploring treatment options like therapy and medication can make a significant difference. Remember, you are not alone, and there is hope for recovery. The causes of depression are complex and multifaceted, often stemming from a combination of factors rather than a single isolated event. It's not just one thing that leads to depression, but a web of interconnected elements that can vary greatly from person to person. Understanding these contributing factors is crucial for both prevention and treatment. By identifying the various elements that can lead to depression, we can better tailor interventions and support systems to meet individual needs. One significant contributor is biological factors. Our brains are incredibly complex organs, and even small imbalances can have significant effects on our mood and overall mental health. Research suggests that imbalances in brain chemicals, particularly neurotransmitters like serotonin, dopamine, and norepinephrine, play a role in mood regulation and can contribute to depression. These chemicals are responsible for transmitting signals in the brain, and when they are out of balance, it can lead to feelings of sadness, hopelessness, and other symptoms of depression. Genetic predisposition also seems to be a factor, as depression can run in families. If you have a family history of depression, you may be more likely to experience it yourself. This doesn't mean that you will definitely become depressed, but it does mean that you might be more vulnerable to the condition. Psychological factors, such as childhood trauma, negative thought patterns, and low self-esteem, can also increase the risk of developing depression. Experiences in early life can shape the way we think and feel about ourselves and the world around us, potentially setting the stage for depression later in life. Traumatic events like abuse, neglect, or the loss of a loved one can leave lasting emotional scars that make individuals more susceptible to depression. These experiences can be incredibly difficult to process and can have long-term effects on mental health. Social factors, including stressful life events, social isolation, and lack of support networks, can also contribute to depression. Our social environment plays a crucial role in our mental health, and feeling isolated or unsupported can significantly increase the risk of depression. Job loss, financial difficulties, relationship problems, and chronic illness are just a few examples of stressors that can trigger or exacerbate depression. These challenges can create a sense of instability and uncertainty, which can be overwhelming and lead to depressive symptoms. It's important to remember that these factors often interact with each other. For instance, a person with a genetic predisposition to depression might find that stressful life events or social isolation can trigger the onset of the condition. For example, someone genetically predisposed to depression might be more vulnerable to developing the condition if they experience significant stress or trauma. Understanding the interplay between these various factors can help us develop more effective strategies for prevention and treatment, ultimately improving the lives of those affected by depression. Section 4. Seeking the Light, Paths to Healing and Recovery. Just as the causes of depression are varied, so too are the paths to healing and recovery. Each person's journey is unique, and what works for one individual may not be effective for another. This diversity in treatment options is crucial because it allows for a more personalized approach to mental health care. Effective treatment often involves a combination of approaches tailored to the individual's specific needs and circumstances. This might include medication, therapy, lifestyle changes, or a mix of all three. The goal is to find the right balance that helps the person manage their symptoms and improve their quality of life. It's important to remember that there is no one-size-fits-all solution, and what works for one person might not work for another. This is why it's essential to explore different treatment options and be open to trying new methods. Flexibility and patience are key in finding the most effective path to recovery. Medication, particularly antidepressants, can be helpful in regulating brain chemistry and alleviating symptoms. These medications are designed to correct imbalances in neurotransmitters, which are chemicals that transmit signals in the brain. By doing so, they can help improve mood, energy levels, and overall well-being. Antidepressants work by increasing the availability of certain neurotransmitters in the brain, which can improve mood, sleep, and appetite. However, it's important to work closely with a healthcare provider to find the right medication and dosage, as it can take some time to see the full benefits. However, it's important to note that antidepressants are not a quick fix and can take several weeks to become fully effective. During this time, it's crucial to maintain open communication with healthcare providers and report any side effects or concerns. Patience and persistence are essential during this period. Therapy, particularly cognitive behavioral therapy or CBT, can help individuals identify and change negative thought patterns and behaviors that contribute to their depression. CBT is a structured, goal-oriented form of therapy that focuses on the present and helps individuals develop practical skills for coping with life's challenges. CBT focuses on developing coping skills, problem-solving techniques, and strategies for managing stress and difficult emotions. By learning to recognize and alter negative thought patterns, individuals can gain a greater sense of control over their mental health and improve their overall well-being. Lifestyle changes, such as regular exercise, a healthy diet, and adequate sleep, can also play a significant role in managing depression. These changes can help improve physical health, which in turn can have a positive impact on mental health. Exercise, for example, has been shown to release endorphins, which are natural mood lifters. Exercise has been shown to have mood-boosting effects, while a balanced diet provides the nutrients necessary for optimal brain function. Ensuring that the body gets the right vitamins and minerals can support overall mental health and help in the recovery process. Additionally, maintaining a regular sleep schedule can improve mood and energy levels, making it easier to cope with daily challenges. Section 5. Stories of Hope, Triumph over Adversity. Throughout history, countless individuals have faced the daunting challenge of depression and emerged victorious, their stories serving as beacons of hope and inspiration for others. One such individual is the celebrated author J.K. Rowling, who battled depression while struggling as a single mother before achieving phenomenal success with the Harry Potter series. Rowling has spoken candidly about her experience with depression, describing it as a suffocating blackness that threatened to consume her. However, through writing, therapy, and the support of loved ones, she was able to overcome this dark period and achieve extraordinary things. Another inspiring figure is the legendary comedian and actor Robin Williams, who brought laughter to millions despite his own struggles with depression and addiction. Williams used his platform to raise awareness about mental health issues, reminding us that even those who seem outwardly happy can be fighting internal battles. These stories, and countless others like them, underscore the fact that depression does not have to define a person's life. With determination, support, and the right treatment, it is possible to overcome the darkness and embrace a brighter future.